Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello everybody, I'm here today again with recovery mom, Sharina. Hi Sharina.
Hi everyone.
And today we'll be talking about the concept of self-diagnosis. So this is when somebody kind of looks inward and they try to create a diagnosis, perhaps out of the Diagnostic and Statistical Manual, and assign it to themselves for a variety of purposes. So, any thoughts here, Sharina?
I've done a video, it was a long time ago, about the dangers of self-diagnosis. And people like to self-diagnose. People like to diagnose other people. And what I found, personality disorders are something people love to diagnose in other people or in themselves. Now, we know I have BPD, it's managed, but I have BPD. And there are the 9 traits listed that are what makes up BPD. And anyone in their lifetime can have, most people I think in their lifetime will tick some of those traits at some point. I say this because my book is out. And I'm already having so many people come up to me saying, oh my goodness, I have BPD. And I think, no, you're diagnosing yourself. This is a really dangerous thing to do. I think sometimes we look for a reason of why we are the way we are. Maybe our life isn't going as wonderful, maybe we have lacking motivation, or we're not happy in our job or our relationship, and we look for reasons why that can be. And so we look inwards and we start picking things about ourselves that oh, okay, so it's almost well, it's not my fault I'm like this because I actually have a disorder. And they say that about themselves, even though no doctor has diagnosed them.
Yeah, I think you're right. I mean, there's something oddly satisfying about getting a diagnosis, right? So I think from a clinical point of view, usually clinicians view a diagnosis as kind of negative, like it means something is there that needs to be fixed. It means a behavior is there that needs to be changed, or thinking needs to be changed. But sometimes from a client's point of view, it can be a relief because it normalizes the experience. And you say, oh, okay, I had all these feelings and these urges and these behaviors, but it makes sense because we've seen it before and there's a name for it.
Yeah.
But the danger, of course, is when that diagnosis is false, when it's, a self-diagnosis by definition would be discarded. It doesn't mean that it's technically incorrect, but a diagnosis has to come through the right channels in order to lead to treatment and to kind of meeting goals and all that. It can't really come from self-reflection. As valuable as self-reflection is, that's beyond the scope of it.
Yeah, I agree. It's kind of, I see people think they see themselves a certain way, whereas maybe their clinician will see them in a completely different way. So they might think, okay, I have this disorder, whereas the clinician is seeing something completely different. But there are times when actually we might be getting some things right. Mm-hmm. Because obviously only we know how we feel and we know our thoughts. And sometimes I think people can get frustrated because they can go to their clinician expecting a diagnosis and they're not getting it. And then they can be left really frustrated because they feel like, look, I've done all this research on this disorder and I definitely think I have it. And they have a professional saying, no, you don't.
Yeah, and they take on a mindset in that interim period between when they decided they have it and when they see the professional. They start working toward what it's going to be like to deal with it, right? And I imagine the same thing happens to physicians, when patients think they have some sort of medical disorder and they start reading up on it, and then they come in, they think, I'm going to have this surgery or I need this medication, and it turns out they don't. I think the same thing can happen. And I've also noticed with mental disorders that there's certain mental disorders that seem to be overrepresented when people self-diagnose. Like in my experience, and I don't want to say a lot of people want the disorder, it's just overrepresented. A post-traumatic stress disorder, that's a very common one that, people will come in and say, I experienced this difficulty or that difficulty. And certainly they're stressful, but they don't meet the technical criteria for trauma, which is actually somewhat rigid, as it's defined. And we talked about before the video, cluster B personality disorders seem to be a popular overrepresented self-diagnosis as well. I think depression in general, just the word depression, even though it's major depressive disorder, persistent depressive disorder, people say, I have depression. I know I do. I'm sure I have this disorder. But then other disorders, I've noticed, almost never come up in self-diagnosis, like alcohol use disorder and opioid use disorder. And sometimes you'll see that, but a lot of times people will say, no, I don't have a problem.
That was me. That was me. I was in complete denial. I could not admit that I was addicted to drugs. So I completely get that. And when I had depression, I didn't know I had depression. I was completely unaware of it. But like you said, I see a lot of people, they say, oh, I'm depressed. And actually, no, a lot of people go through stages in life where they have their ups, and you can have some down times, but it doesn't necessarily, it doesn't mean they're not depressed, but a lot of people think with depression, well, I'm depressed, I need a pill to fix it, when actually what they might need is actually just change your diet, get outside, get outdoors, kind of make yourself do the things you don't want to do, and that can lift their mood. Obviously, depending on the severity.
Sure, yeah, depression is one of those kind of tricky disorders because everybody is going to have, just like you said before, everybody's going to meet certain criteria for certain disorders. Yeah. And many people will meet criteria of personality disorders, but just about everybody at some point would be in some of those categories of depression, like appetite change, not sleeping well, feeling worthless, inappropriate guilt. Everybody's going to have those, and if they see those diagnostic criteria and they don't understand the duration requirements and some of the other requirements that clinicians are trained in, they could say, oh no, I have feelings of worthlessness and my mood's been down for a few days. I must have major depressive disorder. So it's very easy to look at a DSM and really diagnose yourself with probably 5 or 6 of those disorders. It's
like people going onto Google and just Googling some symptoms, and they might just be like, I have a headache for that, and all of a sudden it comes up that they're dying, like the worst case scenario. So I just, never ever Google your symptoms.
Yeah, if you use a Google or some search engine and you're searching for a diagnosis, then the first one you search for is going to be the one you think you have, because the way it works is you'll see that, and then you'll see similar results, and you'll go through, and so if you searched generalized anxiety disorder and explore that out, you're going to find more reasons, more expansion, associated symptoms, associated characteristics, famous people that have it, and you think, oh, I'm like them, whatever. And before you know it, you've self-diagnosed with the first one that you thought you had. Yeah. So that's another thing about self-diagnosis. It doesn't take into account all of the sections of the DSM that have different types of disorders. And there's lots of rules for what you can consider together and where you should go next if you're unsure. Like if somebody doesn't meet the diagnostic criteria, there might be another differential diagnosis that's more suited, but Google's not going to tell you that.
Yeah. Before I forget, one of the things that I always say with self-diagnosis, the danger, this is a danger, is that you can get it in your head. You might, like you said, look up certain traits, and the first thing you see, you think, yes, that's it. That's what's wrong with me. That is what I have. But in doing that, you might actually be missing something that's more serious. And it might be like physical things. You might think, oh, I'm feeling tired, I'm low in my diet, I'm depressed, when actually there might be something physically wrong that you need to get checked out. But a lot of people will go to the doctor, and rather than just saying the traits and letting the doctor decide, they say, I think I have this. And so then the doctor might miss, again, the doctor, because we've put it on them, like saying, we think we have this, we've got this, they might miss something really, really serious.
Yeah, which is why kind of at least a semi-structured clinical interview is really the only good way to get a diagnosis. Somebody has to be objective, put some distance, and start from a completely neutral position. And you touched on something important. If somebody comes in and says, I think I have this, and a clinician starts, looking at the symptom criteria, they've already made a fundamental error, which is not starting in a neutral position, right? So there's a particular way to diagnose, and it doesn't start with assuming somebody has what they say they have, and then trying to confirm that.
Yes.
Because again, that would be pretty easy to do. I mean, if somebody says they have social anxiety disorder, and they give a few symptoms to me, and I sit there and say, well, okay, that makes sense, and then I say, well, do you have these other symptoms? And of course, they're going to say yes.
Yeah.
Right? And I'm not considering other possibilities like panic disorder or generalized anxiety disorder or anxiety caused from the withdrawal of a substance. Like, there's so many other things it could be. It could be anxiety that's caused from a depressive state, because those two go together. There's a lot of possibilities, and it might not be social anxiety. So you can end up in a tough way when you don't look at somebody and say, okay, I'm starting where I start with everybody, which is they don't have anything.
Yeah.
Right? Like in the United States, in our legal system, we have the presumption of innocence. That's one of our kind of our core principles, presumed innocent. I feel it's the same way with a diagnosis. Presume no diagnosis, and then start and find reasons, to support, evidence to support a particular path.
Yeah. It can take time to get a diagnosis from a doctor as well. Like, we think we can so quickly diagnose ourselves. But I know I was under a mental health team probably from the age of 16, 17, and I didn't get diagnosed with BPD till I was 21. And it actually took for me to be an inpatient on a mental health ward for a number of months, where they would watch my behaviour, and they really kind of it just wasn't a quick decision, like, okay, let's tick the criteria. It was so much more than that. And back then I was quite lucky we didn't have social media and that we do now, because again, with that, it's very easy to kind of get caught up in it all. Like, mental health's quite a huge topic right now. Everyone's talking about it, and you get famous people talking about it, and that kind of sparks an interest to people, and then they start looking into it and thinking, yes, I've got the same, I'm the same. Because we like to sometimes feel like, we feel part of something, and a lot of us can struggle with sometimes our self-esteem and feeling down and that, and then when we can feel part of something, it makes us feel really good, even if it's part of something that's not great, like people that suffer with anxiety or people that suffer with depression or personality disorders. It's like finally we feel part of, basically.
Yeah, I have noticed a real bias. Every time a celebrity comes out and says they have a disorder, I have kind of a mixed reaction, which is, okay, I appreciate their courage, right, to stand up and to kind of take on the stigma, and I think that's wonderful. But at the same time, you're going to see more people saying, oh, that's what I have. This celebrity came out and said they were borderline personality disorder, or they have histrionic personality disorder, something, relatively unlikely, and you think, they don't have either one of these. It's because they're kind of associating with that individual.
Especially teenagers, because they're kind of, I see it all the time, like young girls. And I mean, I think I did a video, like, is mental health seen as cool? Like, do people think it's cool? Because there was a phase that went about where loads of teenagers started self-harming because they were reading about it. And is it cool to say I haven't, because they see these famous people saying they have this, and then they want to be the same, so then they start saying, and I do see it particularly like I said within teenagers.
Maybe something that's going on there is that being normal, for lack of a better word, like not having a diagnosis, although you could argue that's not normal anymore, but not having a diagnosis is not special enough.
Yeah.
So if you have a diagnosis, if you have something where somebody should pay attention to you, and it also could explain behaviors that you're not proud of.
Yeah.
You can put that in the diagnosis, which may be legitimate or not. But yeah, there's actually some appeal, oddly, to kind of adopting a mentality of, oh well, I must have some disorder that's kind of driving me and pushing these different behaviors and emotions out.
Yeah.
And yeah, it definitely goes in a trend, right? There's fads that come and go.
Yeah.
And I notice there's certain disorders, though, that, like I mentioned before, people don't seem to be as drawn to, right? I don't know why, like personality disorders, people do seem to be drawn to those, why they're considered glamorous or more desirable or less offensive, or however you want to think about it, than the substance use disorders and some of the other disorders. Like, if you think about, like, paraphilic disorders, you don't see any celebrities saying they have paraphilic disorders, right? Like,
No.
I don't think that would ever happen. But definitely there's celebrities saying they have personality disorders and depression, anxiety. So, in a way, I mean...
Especially the cluster Bs.
Yeah.
The dramatic. I suppose maybe that's what it is. People like the drama.
Yeah, I mean, cluster Bs have a lot of, I guess, dramatic appeal, right? The way the symptom criteria are worded. There's a lot of, like, charged words in there, deceitfulness and, criminality and emotional dysregulation, where some of the other disorders are relatively boring compared to that, I guess, right? But again, only boring through the lens of somebody who doesn't understand all the different disorders and the criteria.
Yeah, I also think, like with the cluster Bs, the traits are more likely to be traits that anyone can have than, say, some of the, like, cluster As. I think there's one, is the cluster A, they can put on a funny voice and wear funny clothes, like they seem odd. That kind of isn't like a general rule for lots of people, but with the cluster B, like you said, the mood swings, the insecurities, deceitfulness, stuff like that, that is isn't that like a human thing to some kind of, we all can have that at some point.
Oh yeah, I mean, and if you look at the cluster B pathology of the criteria, yeah, a lot of people are going to meet a lot of those different elements from time to time. Like believing relationships are more intimate than they are, histrionic trait, fairly common, or a sense of entitlement, a narcissistic trait. Everyone's got that to a point. I think the disorder you were referencing before was schizotypal personality disorder, where you have like odd, magical beliefs and thinking and speech.
Yeah.
Yeah, so again, the cluster A, paranoid, schizoid, and schizotypal, you don't see a big run on those for people like celebrities saying, hey, I have paranoid personality disorder, or I have schizoid personality disorder, although you could argue that being a celebrity is kind of inconsistent with schizoid personality disorder because they tend to be loners. But yeah, maybe it's maybe there's no appeal in saying that, or maybe those personality traits aren't consistent with the celebrity lifestyle. That's something else to consider. Maybe people that are drawn to that, like extroverted, or more likely to have something from cluster B.
Yeah, I find like a lot of people, when they do self-diagnose, it tends to be like BPD or histrionic. But when people diagnose other people, it tends to be they're antisocial, they're narcissistic, especially the narcissistic. And I see it all the time. And don't get me wrong, I've done it myself. I'm guilty of saying, oh yeah, definitely narcissistic. Like,
yeah, I think the trouble there is that narcissism, everybody has narcissism, and the personality disorder is, of course, is different than that. It's a severe manifestation where there's distress and impairment, and it only covers the grandiose side. So our use of the word narcissism is making it lose value or meaning, but it's also kind of combining it with the disorder.
Yeah.
Where if somebody's narcissistic, therefore they're mentally disordered, which is not the case. Most people who are narcissistic are not mentally disordered. And the same thing with the use of the word psychopath. That's a very popular, that person's a psychopath, this person's a psychopath. Well, many people are psychopaths. But psychopathy is not the same thing as antisocial personality disorder. That would be an extreme manifestation of one type, factor 2 psychopathy. So psychopath doesn't have to mean something evil or bad or destructive or, all these stereotypes it has. It's just a set of traits, being callous and calm and manipulative and things like that. But yeah, everybody has, those characteristics are everywhere.
Yeah.
So yeah, we throw these words around, and you're right, if somebody's diagnosing somebody else, they're going to pick certain disorders.
Yeah.
They're probably more likely to pick substance use disorders. Like that person has alcohol use disorder, they're going to jump to that just because they have a drink, and, psychopath and narcissist and all that. So yeah, we see a real bias with the self-diagnosis and the other diagnosis.
What about Ted Bundy? Lots of people say antisocial, psychopath, narcissistic. Mm-hmm. But when I watched the Ted Bundy tapes, obviously with hindsight, looking when we know what he's done, the evil crimes, it's very easy to say that. But actually, before he had been caught and known, he just seemed like normal. Is that typical? Do most people that are that kind, that evil, that horrible, how can we spot them if someone like that seems so normal? Do you understand what I'm saying?
Yeah. I think, and obviously, the standard disclaimer, I can't diagnose anybody, even Ted Bundy, so I'll get that up. But yeah, I think, what happened with the situation with Ted Bundy is there was, it seems anyway, from the reports, he had a good deal of superficial charm, which is a part of psychopathy, but doesn't have to be. Like, I've met people who are psychopathic who had no charm, right? But they had some of the other kind of deleterious characteristics we associate with psychopathy, like lying and hurting people. But Ted Bundy appeared pretty strong in the charming kind of area, and especially short-term interactions, he could really pull off seeming, better than normal, seeming friendly and gregarious and kind of assertive in a good way, and being empathetic even, right?
The sort of person you'd want to hang around with and have as a friend.
Yeah, he could pull that off for a short period, and I think that's really, in that kind of critical moment when potentially, victims are thinking, or potential victims are thinking, should I trust this person? Should I go to him, to his car, and all these different ploys he used to get people kind of away from where they were so he could strike them with a blunt instrument or whatever he used at the time. They're processing these things and they're thinking maybe something like, well, he looks like he's not aggressive and he's being sweet. His disposition is sweet. And, I'll just walk here with him. It's only a short distance, and he's injured. He used to have a fake cast on his arm to simulate being injured. So, for that short period, they would go along with it, and that's all he needed, because he would strike very fast. He would get them to the car, and that's when he would assault them or get them nearby. So he didn't need to really build a relationship. I think if he did, I think a lot of the victims would have realized something was amiss, because it's a very surfacey charm, and when you get below, you see there's no depth or sensitivity or insight.
But he had a relationship with women for a few years, and when he was studying law or he worked in law enforcement doing something, everyone around him, these people saw him daily. They had no idea. They, one of the women that went on and had his daughter actually, she stood by him until he admitted that he had committed the crimes right at the end, and then she cut all contact because she had every faith that he hadn't done it, because he was he'd been around her son and seemed normal. That's really scary, I find, because then it's well, I could have someone like that around me. How do you know? Signs?
Yeah, I think, well, it's interesting what you're talking about with the different people not seeing that there wasn't depth there, that the social skills really weren't developed. And yeah, some people, I think he could have been their presence for years and they still believed him, and they didn't figure it out. But other people seemed to figure it out relatively quickly. So, it was maybe his ability to fool some consistently that gave him that. But yeah, when talking about like how the signs, like how to pick out someone who's potentially psychopathic or narcissistic and psychopathic or dangerous, we see with Ted Bundy in his particular case, he was what they call a power control killer. So he didn't kill for money. He didn't kill for fame, right? He killed for essentially dominance over women, right? A sexual gratification that he gained from that process of murdering and assaulting them. So that's really kind of lined up with sadism, like he was sadistic, right? So that's certainly, I think, one very bad sign. If somebody has sadism directed toward any other human or any type of animal or anything, that's a poor indicator of at least that particular type of behavior, that power control killer. That doesn't mean everyone who's sadistic is going to turn into a serial killer, but that's one thing that, is, to me, probably one of the more obvious and disturbing signs. And to some degree, I think that, and this gets into a kind of a tough area, when we see any type of deviation moving towards sadism, like sexual deviation that moves towards sadism, some of it is somewhat normal, like consensual adults that do what adults will do. But when it gets to be outside the consensual realm, even a little bit, that to me is kind of a bad indicator. Again, it doesn't mean everyone who does that's a serial killer, but that worries me because there's like some desire that they have to dominate and control. And it's not healthy. It's not compatible with good relationships. In order for a relationship to be good, there has to be consensual activity, not pressured activity or coerced activity. I think what's interesting specifically about Ted Bundy that made him difficult to catch, though, is he didn't really seem to exhibit that, at least in the reports, with his girlfriends, right? He wasn't trying to dominate them and control them. He exhibited that in a moment of rage, a limited time period of rage with those specific victims that he selected. So for him, it was like almost like an explosion where all these bad characteristics were manifested in 10 minutes or 15 minutes or a few hours. And you really didn't get much indication from his long-term behavior, which is weird because usually that's where you would definitely see something like that.
Yeah.
Yeah.
Can I ask, this is probably going off topic actually, it's on Ted Bundy, but I'm watching a lot of things on Netflix about getting in the minds of serial killers and that. With someone like Ted Bundy, do you think like this, say, sadism, does that stem from childhood, some kind of abuse in childhood? Or can someone have a perfectly good life and then just be sadistic?
Yeah, I think it's possible for somebody to be born that way. But I don't think that's what happens the vast majority of the time. I think most of the time somebody is abused, bullied, and maybe they have a genetic vulnerability towards psychopathy. But at some point, relationships, I would think, with women, are going to go astray, and that is going to have an impact on them. And we see that with Ted Bundy. He had trouble in his peer group. He had trouble relating to both men and women when he was young, boys and girls. And particularly, I think, with women, I think he talked about the status, like in the tapes, in the Netflix tapes, he talked about like women of high status, that one woman he dated he thought was of high status, and how, it seemed like there was resentment and anger there. And he was able to contain that for the, much of the time and then release it kind of in the, again, kind of fits of rage. So yeah, I think most of the time there is actually, and of course it's easy to say this looking back, but I think most of the time there are clear causes that the environment contributes that kind of pick on, that target those genetic vulnerabilities. And, maybe some people are born that way, but I think most are made that way. I think one of the kind of strange things about Ted Bundy in terms of like the public opinion is this idea that he came out of nowhere, right? There was no real clear signs in his history, but I think there were, his grandfather torturing small animals and drinking and beating him. And some reports, if you read, there's different articles and books about it, there are some reports that Ted Bundy himself tortured small animals. So, different people had said that, and that he appeared odd and strange.
Yeah.
And like he didn't fit in, and that he was bullied.
If there was a child with those traits, what diagnosis would they possibly have? Would that be the thing before antisocial?
Yeah, there's a disorder we use instead of antisocial personality disorder when somebody's under 18.
Yeah.
And it's called conduct disorder.
Yes.
And the presence of conduct disorder before the age of 15 is actually required for a diagnosis of antisocial personality disorder later, which is weird. It's the only diagnosis I can think of that has a rule like that, where you have to go back and say, okay, I see at 12 years old, he did something to qualify at least a symptom or two of conduct disorder.
Yeah.
That's an odd requirement. I think part of it's because we don't want to label children as having antisocial personality disorder. That's part of it. And another part is that some people with conduct disorder don't go on to develop antisocial personality disorder. Actually, most don't.
Yeah.
So there's this idea that if we diagnose with antisocial, maybe we're jumping the gun, because around 2/3 will not develop that disorder. So yeah, it would be interesting. I don't think there's any evidence around this, but it'd be interesting to know what was going on with Ted Bundy when he was a child. I don't think he was ever diagnosed or treated for anything when he was young.
His mum upped and left when he was young, though, and because I think the grandfather was so violent. And there was something, actually, that was something I read, that his mum's sister, who was younger, when she was a young girl and he was a young boy, she woke up, I think she was like in her teens, he was about 2 years old, and she woke up and he was sat by her bed with lots of knives.
Right, I think that was in the Netflix special, right? That was discussed,
Okay.
right? Yeah,
I read about it as well. So
yeah, I know I've heard that before. Now I'm wondering where that was, but yes, I remember that, and that that would argue more strongly to a genetic contribution, right? I mean, that's
something not right.
Yeah, again, if you just saw that behavior and nothing else, a lot of children get into things that they're not supposed to get into. Lighters, knives, other types of kind of, sharp objects. Maybe they grab a hammer or whatever. And if you look at it in the context of what he did, then it kind of makes sense. But if we saw it in isolation, we might say it's normal behavior. So it's hard to know what that was. But yeah, that's not a good indicator for sure. I mean, especially positioning the knives.
I know.
Yeah. To touch them or to grab one and play with it's not a great idea, but
yeah.
to
have all the kitchen knives. If I woke up to that, I'd be terrified. Be like, oh.
Yeah, that wasn't such a good indicator for him, but
no.
Yeah, so it's interesting, I think in terms of avoiding, we were talking about this before, in terms of avoiding psychopaths, right, or psychopaths and narcissists. I think, unfortunately, there's always this possibility, especially because of the charm, that they're going to go undetected. In the short run, it's much easier for them to go undetected. And I think people just have to be careful. And it sounds like maybe over cautionary, but if you don't know somebody, don't go somewhere with them, right?
Yeah.
If you're meeting somebody for the first time, make sure it's in a public place.
Yeah.
Try to understand, who they know. Like, try to get a hold of their history.
Yeah.
Although that might not have helped in the case of Ted Bundy, because his history to an outsider would have been unremarkable until he was apprehended. But, most of the time, if you look at somebody's history, it will tell you something about potentially what they'll do in the future. And I think people just need to act with an abundance of caution and realize there are people who are sadistic and dangerous, and we hope not to encounter them, but they represent a fairly stable part of the population in terms of prevalence. And they are out there. And, you don't want to be a victim, so you don't want somebody kind of locking themselves in their house, with a bunch of guns and fearing everybody, but you do have to exercise caution. I think a lot of it's common sense. And I did a video about Ted Bundy a little while ago, and I talked about how the 70s were a different time.
Yeah.
And attitudes are much different in terms of personal safety and all. I think we're much more careful in general now. And probably actually a little better, too, at detecting some of the psychopathic characteristics, maybe because of people like Ted Bundy and all these specials that are made available.
We say, people are more careful now, but I look back at some of the really, dangerous positions I put myself in, going back to people's houses with strangers, not knowing who they are, just wanting to get some drugs and saying, yeah, I'll meet someone down a dark alley. Like, it was, I think, when drugs and alcohol especially are concerned, we forget everything. All we focused on is what we want, and we can put ourselves in really dangerous situations.
Yeah, I think too, there was a movie, I mentioned this a few times in my videos, named American Hustle. I don't know if you ever saw that movie.
Yeah.
Okay.
Yes, I have, yes.
Yeah, I think it was Bradley Cooper and Amy Adams and Christian Bale.
The casinos, was it that one? No.
I don't think there was a casino in it. I think it was, what was it? They were like con artists, and they got caught.
Yes,
Okay.
I saw it only about a month ago. It was set back. Was it set in the 70s?
I think it was the 70s or thereabouts. Yeah. Yeah, so there's a line in that movie, and I'm not sure I remember it word for word, but it's something like, people believe what they want to believe. That line, I think, was delivered by Christian Bale in one of the scenes there. And I think, if you are looking for drugs, or you're looking for something like sex, or something that has like a strong emotional component to it, you're more likely to ignore warning signs.
Yeah.
Right? Because people believe what they want to believe, right? So, you're going to get drawn in and miss some things that could be really important. And a lot of times when people are assaulted in situations like that, they do say, well, gee, now looking back, there were a lot of warning signs I should have known. Right? But it's how clear are you thinking, and how, are the emotions steering the wheel, or is the logic and thinking steering the wheel? And, sometimes thinking and emotion, they kind of fight for control of the wheel.
Yeah.
So there's a lot of variability, a lot of places on that continuum where somebody can be. And if emotions are driving the car, you're going to get in a wreck. And I think that's what happens.
Well, then you look at borderline personality disorder, where our emotions completely, and it makes complete sense why I put myself in those dangerous situations, like repeatedly, again and again. And it wasn't always just like for drink or drugs. If I had a feeling that someone was cheating on me, I would go anywhere, no matter how dangerous. I wouldn't think all I'd focus on, I'm going to catch them out. And yeah. It's one of the dangerous components of borderline personality disorder. It's probably rarely talked about. What would be talked about would be the suicidal ideation and the impulsivity and self-harm and the anger. But another part is, putting yourself in situations without carefully evaluating criteria. Yeah.
And I guess that's part of impulsivity in a sense, but it's like a recklessness.
Yeah, the impulsive, reckless behavior, I suppose it can be put under there. But yeah, it's not really. Maybe you need to do a video on it.
Borderline recklessness. Yeah, that could be a future video. So that seems like a good place for us to wrap up this video. We got some great topics in the self-diagnosis and some discussion of Ted Bundy and psychopathy and how that all works. Any other thoughts before we wrap up?
No, that's it. It's really late here. I'm in the UK. I've actually got pajamas on. Well,
very good. So thank you, Sharina, as always. And I want to thank my audience. If you have any opinions or thoughts about this video, please put those in the comments. And as always, thanks for watching.